Thanks very much, Jordan. Well, the federal government announcing a milestone for its national dental care program. Now, with more than 1 million Canadians using this program now, and it comes as the Liberal Party battles the Bloc Québécois and Conservatives, who are pledging to try to topple the minority government at the next opportunity. So Federal Health Minister Mark Holland is joining me live now with the latest on this. Good morning, Minister. Thanks so much for joining us.
Thanks for having me.
Yeah, we'll start off with this milestone. So now we have a certain amount of people that have been registered, but you've hit this 1 million mark in terms of users.
Yeah, we're so happy. To put this in context, in 6 months, 1 million people, that is the Scotiabank Arena being filled 53 times, filled with Canadians who've been connected to care. And this is on average saving them $730. And it's not just the fact that it's saving them that money. So many instances, this is something as an example, Dr. Redmond, I was talking to him and he's out in Gander, his clinic found cancer 3 separate times in patients just in the last number of months that they've been looking at this. Finding people who might have diabetes or telling them that there's issue with their blood pressure when they come in. So those visits are preventing medical emergencies, but they're also connecting people to the care that they need and potentially avoiding them getting very, very sick. So it saves them money, but it saves our health system an enormous amount of money as well. So 1 million in 6 months certainly exceeded our expectations. It's phenomenal to see this many people connected to care.
Okay, and there is an expansion that is coming starting tomorrow that you're going to be officially announcing later today. But what can you tell us about how the program is going to change?
Well, the good news is tomorrow, November 1st, patients are going to be eligible for expanded services. So those more complicated issues that require what's called pre-authorization to create really a treatment plan. Because it was more complicated, we needed more time for the system to get ready. Well, now we're ready. That starts tomorrow. So more complicated cases. The other thing is phenomenal. We're now at 89% of oral health providers participating. So almost every dentist, denturist, oral hygienist is participating. But we're also now moving to paper claims. So those paper claims will help us get to 100%, get everybody participating so everybody can be connected to the care that they need.
All right. And moving on to, goings on in Ottawa, I know you're making the announcement about the dental care program today in Toronto. However, once you get back to Ottawa, you are returning to this very tense environment where not only is there pressure on the Liberals from outside of the party, but from within as well. You've already commented on your thoughts about this revolt, let's say, that is happening with some MPs. Now there are a lot of questions about whether or not Trudeau should continue as leader. What are your thoughts on the fact that 24 MPs, and they're becoming more and more vocal, are asking for the Prime Minister to step aside, but also looking to create a secret ballot so that this can be done and this can be decided as soon as possible?
Well, you got two choices, right? Every party's got their divisions. Every family has their differences, right? And the question is whether or not you are democratic and you have open conversations or whether or not you lock it all down. I'd be very afraid of political parties that all say the same thing and never disagree. That's not democracy. That means that nobody's listening to anybody. This will be my 8th federal election. I've been doing this for 20 years. I've been in a whole bunch of different caucuses. This kind of division and difference is always there, but there's no difference about what we want to do. Our values and the fact that we need to stop Pierre Poilievre would cancel this plan. That means a senior who needs a pair of dentures aren't going to get it. That means that those cases that I talked about where somebody's got cancer doesn't get detected early. What happens to that person? Like, this is fundamental stuff. We have a chance to transform our health system into a prevention-based system. Did you know that 70% of what's in our hospitals and our ER rooms shouldn't be there? It can be prevented. So we need to do the work with provinces and territories. That's what I'm focused on. Right. And I have full confidence in the Prime Minister. He's an extraordinary individual who has my full support.
You talk about division within parties always existing there. Yeah. People will disagree. This is on another level, though. You have to see that, where you have MPs that are coming out publicly questioning the Prime Minister's ability to carry them through another election. That's a whole different story.
Well, not to me. I mean, I was elected in 04. I had elections 04, 06, 08, 11. That was just called Tuesday back then. I mean, that's just what went on. Look, the reality is the difference then versus now is there isn't people. Then there were battles over power and ego and who could climb to the top. This is just about. We are terrified of what Poilievre is going to do to this country, each and every one of us. The conversation that we're having with our families and in our caucus is what are the things that we can do to make sure that the things that we care about don't get cut, they don't get attacked. So that conversation is a very civil conversation around how we can put our best foot forward. And it makes sense that we have that conversation in a way where different opinions are expressed. But the vast, vast preponderance of our caucus has full confidence in the Prime Minister. And many of those who had said maybe it was time to consider leadership have already said, no, caucus has decided. And by the way, our leadership is decided by members, by our Constitution. It is, and I became a member of this party when I was 14 years old. I take the idea of being a member and having the power as a member to choose a leader very, very seriously. They're the ones who holds that power. So we're unified in what we want to do. We're unified in getting work done. We're unified in transforming our health system. Like talking here about dental, big numbers. But we're doing huge things on pharmacare. We're doing huge thing on transforming data and making it more interconnected. We've signed bilateral agreements. We have school food. We're doing all kinds of positive things. And what I learned through all those years of service is that when you wake up in the morning, focus on getting things done for people. Focus on the work ahead of you. There's too much politics going on in Ottawa. And when I talk to people, they want to hear results. They want to see you focused on making things better.
Okay, we've run out of time, unfortunately. Minister Mark Holland, thank you so much for joining us. We appreciate it.